Good morning and good afternoon. Welcome to the Weekend Wellness Hour show. I am very excited to have a returning guest, Dr. Stasha Gominak, who is going to be joining us today again for a different topic, but still related to sleep. So just to remind you that Dr. Gominak, Stasha, she was trained through Harvard as a neurologist and really dove into sleep and helping people overcome a lot of different issues with sleep. Specifically, we talked last time about was vitamin D and the relationship of vitamin D hormone to sleep issues and how to look at that differently. This time, we're going to be talking about mothers, kids, and pregnancy and how that impacts sleep and what we can do. So thank you so much, Stasha, for coming back on.
Thanks for inviting me back. I'm thrilled to tell people about this.
Yeah, and this was funny because we were ending that conversation last time and you mentioned this topic and I said, wait a second. I know so many women, so many mothers who are suffering from sleep deprivation related to having kids. And I'm very excited to hear what you have to say. So please join us.
Okay. So should I just jump in?
Yeah, yes, please jump in. Please tell us, we know there's issues. Babies need.
I want to start with the first group that I was studying sleep in, which is young, healthy women with daily headache. So there's a subgroup of people who are usually women, not always, who are otherwise healthy. Only thing that they've ever done is have a couple kids, and then they start to have daily headache. And I stepped into the study of sleep through that group. But as I then, and we're going to then fast forward, the last interview was about discovering D had a role to play. But I want to just say in those patients, there were interesting things like I wasn't paying particular attention to infertility, but I had noticed other things. So when I started to read about D, I started to wonder, well, why do these women have any medical problems at all? Why do they have gallbladder disease? Why do they have thyroid disease? Why do some of them have miscarriages? Could any of those things be related to D in the background, since we completely missed the significance of D? So that was my first introduction to, could it be that there are other things that I as a physician was just taught, oh, that just happens. Like we don't have an explanation for miscarriages. So as I start to read more and more about D, I fall into Walter Stumpf's material. And Walter Stumpf was writing about, he's an endocrine chemist and a neurologist, but mostly spent his life as a chemist writing about vitamin D and where the vitamin D receptors are, and then writing various articles about what will happen if the D goes low, what would be the implications. So one of the most important articles is about how there's D covering the placenta. So D plays a huge role in the blood-brain barrier, and the blood-brain barrier that protects the fetus from the mom's immune system. So he writes this whole article about if there are vitamin D receptors covering the placenta in all these animals, that means it's playing a role in making sure that you can take the pregnancy to term and your body doesn't reject the baby. So that's number one. Another one is, oh, there are vitamin D receptors in the ovaries and the fallopian tubes. And that means there are vitamin D receptors in the ovaries. Oh, it turns out since then, there's literature in the OBGYN literature that shows when the D is low, there's another hormone that's a blocking hormone called anti-Müllerian factor that blocks the ability to ovulate. That means polycystic ovarian syndrome is a straight vitamin D deficiency disorder. It started to be reported in the 80s as well. That's a disorder where the ovary has what are called polycysts, which means each one is an egg. It's trying to ovulate. It gets big, it gets filled with fluid. So the whole syndrome of polycystic ovarian syndrome is linked directly straight to vitamin D. No other vitamin deficiencies needed. And it is frequently seen in women who have infertility. The second vitamin D receptor location is in the fallopian tubes, which means that especially for humans that are very unique in the mammalian world, our fertilization has to happen mid-fallopian tube. So what that means is there are cilia, little tiny beating fibers that are sitting, I like sea anemones, that are sitting on the lining of the fallopian tube, and they beat from the ovary towards the midpoint of the fallopian tube. And then there are other cilia that beat from the bottom up. So it directs the egg and the sperm. So it helps the sperm go up the tube and it helps fertilization happen in this very specific place. Then the egg has to, once fertilized, moves down into the uterus. Well, that implies that if those cilia are being helped by vitamin D to be beating in the right direction and have everything work consistently, that there's an increased risk of tubal pregnancy in people who have low D, which my daughter suffered from. And it also means that if you do not have the proper help, both from ovulation and from getting the egg exactly where it's supposed to be, you have an increased risk of infertility. So there are multiple effects of D. So D is directly designed to keep you from having a baby when there is no food. So there was a reason why over the last 250 million years, if there's no food and you get pregnant and have a baby, you will not have any food for that baby. Okay. Also, there was an aspect to, in the past, there was no birth control. So women could have 10 babies and then die, 100 pounds overweight. Dickens' wife had something like 10 babies. And then he threw her out of the house because she was so obese, and he fell in love with some 18-year-old. And I was reading that at the time. I was reading about that at the time that I was doing this. And I was like, one, what a jerk. And two, it's not her fault. And it turns out if you're able to get your D level up after each pregnancy, which depends on your skin type and where you live, etc., you can actually bring your D level back up again, enough to become fertile again, but that your D isn't high enough to keep the baby to term. So that was one of the things that protected women from having babies too close together. Like if you couldn't really get your D up, you would have the second pregnancy, which was only 8 months after you just started breastfeeding, you would actually lose that baby in a miscarriage. So when I take the history now, I'm looking for which pregnancies, did you have any miscarriages before or after? And they relate directly to what your D is doing. And it made for the whole group of mom, dad, and the kids to survive better, even though the woman had, a miscarriage that she was sad about, or maybe she wasn't sad about. But in the time before birth control, this was the only thing that kept you from actually dying from having too many babies in a row. Also, it's not uncommon that you can actually look at a series of pregnancies in a woman who had an easy pregnancy the first time, and then the second time, the second child has more trouble with sleep than the first one, and then the third one starts to have a peanut allergy. So you start to see things directly related to how many pregnancies she's had. So after the second pregnancy, she's lost her microbiome. So we talked last time about how D establishes the normal microbiome. One of the things the reasons why I have a website is my experience was that if your D falls too low and stays too low, then you lose your microbiome, and even taking D or bringing your D up again with the sun does not reinstate the right population of bugs or bacteria in the microbiome. That means when you are actually carrying that baby, especially in the first 4 weeks before you even know you're pregnant, your source of the B vitamins, which have all been linked to the primary problems with early development. So the midline developmental disorders of cleft lip, cleft palate, or the ones from the neurologist where they have poor fusion in the back. Those are all connected to B vitamin deficiencies in the first 4 weeks of pregnancy. That means if you do not have a normal microbiome, and if you aren't on prenatal vitamins, and we'll talk about them in a minute, you can actually have certain fetal developmental problems that will greatly affect what will happen to your baby. I've had several clients in the past who've had 2 or 3 babies with actual birth defects, like cataracts or cleft lip, and they are really exactly related. That the primary literature is there. The piece that was missing was to realize that a mom should never get pregnant until we know her microbiome is intact. Now, the hard part is, how do we know it's intact? What has been our dogma surrounding why it went bad? So up until me telling you this story, we've been told that the microbiome has gone bad over the last 40 years around the globe because we use antibiotics. I would claim that that is not correct. Okay, it's not completely incorrect, but it is not correct either. that means you can't bring your microbiome back just by not having antibiotics and taking D. And I say that because that was my experience with my patients. So their IBS did not go away in response to D, even though I thought it should. And what the bugs really needed was not only the growth factor D, that you're supposed to be supplying it because you're out in the sun and the bugs are down there in the dark inside you. They are also supposed to get the 8 B vitamins as a combination. So if you supply your bugs by making a bee soup of B50, which is what I talk about in the workbook. So you give them D and B50 for 3 months, poof, they're back and the IBS goes away. So it's really not just about the antibiotics. So the other reason why I say that, there are two observations that suggest that the antibiotics are not to blame for this epidemic. One is that my generation and the generation before me, so between 1945 and 1985, we had lots of antibiotics. We all got antibiotics for strep, okay? But IBS did not show up in the population until the 1980s. And IBS, irritable bowel syndrome, is a stupid term. And whenever we're using a term like that, it means we don't have a clue of why it happens, okay? You have a lot of complaints. Your belly isn't right. You can't eat this, you can't eat that. Oh, I'll make up some silly name for it and say IBS and then shoo you out of my office, okay? That is a real syndrome. And we've now established that it means you usually have the wrong bacteria living inside you, but it wasn't actually because of use of antibiotics. The second thing that makes me think, not only was it my experience that people could still cure their IBS and use antibiotics safely, and their bugs would not go bad. So that's my experience after discovering this. But before that, the other important part is we actually discovered the antibiotics from the bacteria. Actually, there was a penicillin mold that growing in a petri dish that had a clear zone around it. And somebody said, hey, I wonder if they're secreting a chemical that kills their competitors, okay? That means early microbiology found that the bugs are smart enough to make antibiotics. We stole the idea from them. That means our normal microbiome has always protected us. That means the components that grow inside us, in our nose, in our mouth, in our ears, all over our skin play a role in these making these antiviral chemicals, antifungal, antibacterial. So those infections, like fungal infections of the toenails in particular, have moved into younger and younger and younger population because we don't have really the right immune system, which part of it is this organ of the body. So when you lose your microbiome, you lose an organ of the body that is particularly important. And we're going to talk about that for early fetal development in a minute, because it's not just the B vitamins only, it's several other things that the microbiome contributes. Do you want to make any comments or questions about that, Amy?
Yeah, I do. That was fascinating information. So if we're looking at vitamin D as well for early pregnancy, and we're looking at, okay, first we have to correct the gut microbiome. So does that also mean, because we talked about last time, taking blood measurements of vitamin D. So is that usually a recommendation then, get that checked out first as you're repairing your gut microbiome and then become pregnant?
If at all possible, it would be nice to get this whole program settled, one, to improve your fertility. And then when you do get pregnant, you have already the normal supply of bees because you have a normal microbiome. But in actual fact, sometimes it doesn't actually adjust correctly. Like, for instance, somebody signs up with me because she's had 2 babies. This is a sleep dentist, 2 babies, neither one of them sleep very well. And she hears one of my lectures. So I say, are you using birth control? And she says, no, I'm still breastfeeding. And I say, if you start this D, you need to be choosing birth control. And our next visit 6 weeks later, she's pregnant already. Because D will make you very fertile. You don't have to take anything else. You just increase the D above 40 and boom, you'll get pregnant. A lot of times you can trace that back and when you conceive, because at any rate. So what does that mean? That means that we also have to feel comfortable with the science and the practice of taking vitamins during pregnancy, which most people have just said prenatals and then they just drop it. They don't, there is no recommendation for what that should contain. So going back, one, the D is the thing that you have to be measuring. And in pregnancy, you want it to be in the 60s. That's what you want. And you want to be doing a D level every month. Most of the pregnancies I've watched women through, if they've been doing the right sleep program and their D is already in the 60s before they get pregnant, then it usually stays at about the same dose to maintain that. But in anybody who hasn't been doing that, you want to be very, very careful about making sure D plays a role in trophic or growth factors all over the body. That means you want to make sure it's in a safe range. Now, having said that, it also means that D is safe to take during pregnancy, but you must be doing your D levels. And then the second piece is, if I'm 3 months pregnant and I happen into the right sleep protocol, what about taking B50? Because B50 is a large dose, all 8 Bs preparation. That is approximately what your microbiome would be making if you had a healthy microbiome. Now, why do I say that? Because our nervous system and our whole body was actually second on the planet after these bugs. So the bacteria came first. They were here for billions of years, and then we came. That implies that our biochemical use of all of these factors was actually built around what they make. And when I give B50, most people feel completely normal. As long as their intestinal microbiome is not making the amount they need, then B50 usually feels about right. And so you can use this same concept to say, even if you're 3 months pregnant, when you start B50, you are using your own body's reaction. Okay, so if you feel perfectly fine, that means you are adding those Bs to what your microbiome is currently making. And your nervous system is the check, is to see whether or not, and that means your baby is now receiving all the B vitamins that he or she should be receiving to make sure that there's normal mental development, normal physical development. Also, in the background, you need to get your microbiome back in order to supply what are called the endocannabinoids. So the endocannabinoids are chemicals that our nervous system uses, very important during brain development, but also as we are adults, as we are developing as children, and then maintaining. The endocannabinoids play a huge role in pain perception, in appetite, in all sorts of things that have to do with the things that you see responding to cannabis. Because we vilified or made it a villain, cannabis was treated as though, oh, it can't be important. But in actual fact, we make our own cannabinoids. That means there are cannabinoid receptors, and there are other medications that we use that duplicate it, but we've actually purified pieces out of the cannabis plant. Now, the important piece of that is there are studies that show in mice that if you lower the vitamin D level to mice, like you don't feed them enough D, and then you follow what happens to the bugs in the little mice bellies, they lose species that make the building blocks that go into the mouse and becomes the endocannabinoid. That means that their brain and nervous system development is not normal, and they present with things that are very similar to autism. So autism has a feature that's not always present, which is the child perceives light moving touch as painful. So they don't want to hug. The tags on their clothes bugs them, okay? That is shown to be related to endocannabinoid levels. What that means is when you don't have the right microbiome, there are multiple things that are not being provided by this organ of the body that you should have had, that science is just beginning to understand, okay? So that means getting your microbiome back, even if you're 3 months along, means that your baby over the next 6 months has the normal supply of these things, and it's not even being replicated by prenatal vitamins. So the B vitamins are just a tiny part of what we're going to ultimately understand about this.
Yeah.
Now, in the background, when you get to 3 months pregnancy and you have no symptoms, but you know that your D was 26, and it has been the last few times that you measured it, and then you kind of have to learn a little bit about what the clinical symptoms are. So let's say you've had infertility. That would be one thing that would say, oh, maybe your D's been low and that's been related. Should I just assume that my microbiome is bad, even though I don't have IBS? And the answer is yes, you should. Because what I found when I was first into these B vitamins, if I didn't do them right at the beginning, then the person would be back to see me again a year later with something bad that was actually based in the fact that I hadn't brought the microbiome back at the beginning with the B vitamins. Now they're developing lupus or something horrible because they're B deficient. So this is now presented in my workbook on my website as a beginning recipe to start. Okay.
Yeah.
And B12 is always an important player too, and it's separate. So you have to look at the workbook for that. There are also several things that are written about pregnancy in B12 and B12 in sleep. So in the background, one, vitamin D can be used directly to increase fertility, which is in the OBGYN literature. It's not like this is not known. So women are spending hundreds of thousands of dollars for infertility because they do what their doctor tells them, which is to put on sunscreen. And all you really have to do is go to the Bahamas, leave out the sunscreen, and have sex, and then you're going to get pregnant. Okay. Now, that's not as simple as that, because I want you to know the next part. You don't want just a pregnancy. You want the most healthy, well-developed, perfectly sleeping baby that anybody's met. So you can cover all of those expectations or wishes by then, even if you're already pregnant, doing the right sleep program, watching their D levels. And I've now had 2 or 3 pregnancies where the woman has already had 2 or 3 kids and is having her 4th or her 3rd baby through right sleep. And the differences are amazing. So for instance, I'm going to give you the example of the dentist I told you about who got pregnant right away. So she's doing right sleep. She's had 2 sons. She's now pregnant with a daughter. And what she notices is she goes all the way through 7th month and she's working full time as a dentist. She's not having any problems at all. She's not having any sleep disruption. She doesn't have any reflux. She doesn't have back pain, all the things that she suffered. She doesn't even have neck pain, which she blames on her dentist being a dentist and leaning over people all the time.
Yeah.
And then we're into about the 8th month, and she's actually getting into a place in the right sleep program where we need to dial up the B vitamins. So this is a part we don't have time to talk about, but there's an aspect to sleeping better with D. That means that your body says, I have all these deferred repairs that I'd like to make. And I have now been having exactly the right amount of Bs to make my nightly maintenance. But now something happens around the 3rd month after stopping B50. Anyway, she's turning up the B vitamins. We're getting to the 8th month. She starts to have leg swelling and back pain and reflux. And I say, we've already said that everybody says this is part of pregnancy and you're in your 8th month. So you wouldn't expect otherwise. And this is what has happened to you in the past pregnancies. But let's just turn up the B5 until we get to where you can sleep through the night, which is what we do all the time in people who aren't pregnant. And her back pain goes away and her leg swelling goes away and her reflux goes away and she sleeps through the night. She also notices that her child is now sleeping through the night when she does. That when she wakes up, her daughter starts to move around. And when she settles to go to bed, her daughter quiets. And what the literature said from the 60s and 70s was that the day-night cycle already starts to establish in babies at 30 weeks, that they start to have the brainstem development and the cortical development that they need in the brain to actually develop a sleep-wake cycle that's 24 hours if the vitamin D in the mom is normal and if all the B vitamins are there. So when she gives birth, that baby is only waking once to feed in the night, and by 6 months is sleeping all the way through. And I've had 2 separate women who have exactly that outcome. Wow. So at the time it was hypothetical, but getting to watch this, especially in women who've already gone through 2 or 3 other pregnancies, where this pregnancy is really, really different and where you can move the Bs. The reason why it's important to know about this is the B vitamins are things we have in our hands. Once I and everybody else have suffered before you, now we kind of know how to use them and how to judge what your body wants. So that means that this right sleep program is usable in anyone who has endometriosis, anybody who has polycystic ovarian syndrome. So all these things that they tell us are the preambles to infertility. They are D related, okay? Endometriosis is about that D not keeping the endometrial tissue from going up into the belly. So endometriosis is the uterine lining which the tubes are open. They're open into our abdomen to get the egg. The tube is open, but the D is gone. That means the little cilia that are constantly going, woo, get back down there, get back down.
Yeah.
So as the endometrial tissue loosens a little bit, it pushes the endometrial tissue down into the uterus and out the cervix where it should go. The second piece to this is the women who have endometrial tissue that goes up into their belly need an immune system that is constantly, so these little macrophages are looking around for endometrial tissue that doesn't belong there, up in your peritoneal cavity, and it finds it and it kills it and gets rid of it. So it doesn't bleed monthly and irritate the peritoneum, which is what makes the symptoms happen. So the endometrial torture system goes away as well. But it's twofold because D has a big, strong play in the immune system as well. There is also a big literature about getting the D up and in a safe place during pregnancy to prevent eclampsia. Eclampsia is a poorly understood, but almost always very stressful and sometimes fatal illness that has high blood pressure and an autoimmune disease against the lining of the blood vessels. So that is well worked out now that it's an autoimmune disease, but the connection to D is written. There are lots of articles that say, get your D up, and I'll tell you about what the problems are, but they've already done all these epidemiologic studies showing that your likelihood of preeclampsia or eclampsia, your likelihood of preterm delivery, your likelihood of autoimmune diseases during pregnancy are all really increased in people who are D deficient. Now, the next question would be for anybody who wants to do this, and for those scientists who are writing those articles, the next question is, what's the D dose that I should give? Now, the problem is that's the wrong question, okay? It is right to say, could vitamin D prevent this? But it is incorrect to say, what is the dose? Because the misnomer of vitamin word, for vitamins, there's a dose. It's not really as simple as that, but for vitamins, we've established that it's a public health thing. So just to say vitamins, you go, oh, public health, we're going to give these doses, we're going to see what happens, we're going to measure their levels. But D is not a vitamin, it is a hormone. That means that you really, if you want to study, if I give vitamin D, can I prevent preeclampsia or preterm delivery or any of these things that we've seen in association? The correct question is, what is the correct vitamin D blood level that, if maintained during the whole pregnancy and then leading up to the pregnancy, would prevent these outcomes? We didn't get into last time, but you have to do blood levels every month during pregnancy. Now, the cheapest that we find those is $39 when we're doing them ourselves. If you were going to run these studies, you would have to have a nurse practitioner or a graduate student or somebody assigned to testing every month and adjusting the dose so that the blood level stays maintained. And picture, sometimes they're outside, sometimes they're not. Every single human being's D level is slightly different, and they need different doses. That means you have to get really good at how to do the dosing of this. And it's extremely expensive to do those studies, even though they have already been done. So there are already a couple, Bruce Hollis, who's a pediatrician, and Carol Wagner, who's writing about this over the last 30 years, saying, we got the vitamin D level to stay in the 40s. Here was the reduced incidence. So they did prospective trials that were controlled. There's lots of literature already documenting this. Unfortunately, because there is no drug to be able to make a profit from, there is very little funding for showing that it is actually completely healthy for you to be outdoors, put on sunscreen if you need to, measure your D level, and make sure that you are in an environment outdoors where your body is biologically normal. You have to hack a few things because we haven't been right for 40 years. But once you do that, there is no profit for anyone. Because you're healthy, your baby's healthy, you don't have to buy any drugs. That means there's very little funding for doing these extremely expensive studies, which means that the reason why I'm here is I see these dramatic things happening. I'm not a scientist. I'm not interested in that part. I'm interested in what the scientists are saying, but I want to see my client go to full term and have a happy baby. Okay.
Yeah.
That's the part that makes me satisfied. So I am definitely fully a clinician. And then I use the science because I'm curious, like you are, like, why does this do this? Okay.
Absolutely.
So it means that I actually have some literature on my site that's addressing why the clinical trials, especially since the VITAL study, there's a study called VITAL, the VITAL study that was done and first reported, I believe, in 2019, that claimed to be studying 25,000 individuals over 5 years. But right off the bat, as you start to look at how it was really done, they gave 2,000 IUs to the treatment group for 5 years, but they didn't do levels. 2/3 of them got levels at the beginning. Only 2/3. The rest of a third of them never, ever had a D level, even at the beginning. And then, despite reporting on 25,000 people, 836 of the treatment group got a second vitamin D done at 1 year. And it's not even clear that they had a first one. Like, they could have done some of them that never had a first vitamin D.
Yeah.
And then they average it together. That means no one really knows if they were taking the D. No one really knows what the level was. And anytime you're studying a hormone, you have to understand that you have to first say, oh, this is a sick level of hormone. Your T3 is this. Your thyroid hormone is low. And then you have to establish what's a healthy thyroid hormone. And then you have to show that you stayed in that range for 5 years in order to actually get some results that you can do something with. This particular trial was published by the New England Journal of Medicine, a very reputable journal. This would never have been allowed with a new drug. I mean, it's so sloppy, and it's been republished 11 times for 11 different things. So for macular degeneration, the first one was for preventing heart disease and cancer. And then they've written it again for macular degeneration, for falls. The last one was about bone health. So they took this terribly designed study that is guaranteed to have a negative outcome. And now it's being used to write editorials saying, this is all hype. There's a vitamin subculture that's trying to get you to take vitamin D, and it's not good for you. And this is why. So that when you go in and you speak to your physician, it's not that they're stupid or don't care about you. It's that they are being purposefully misinformed. And it takes a lot of work to get into the actual literature of D. There is absolutely a minority opinion. Like Harris, Hollis, and Wagner are both writing editorials all the time, but the majority of medicine is not interested. There is a majority of other practices like naturopaths, functional specialists, and everybody else, like those of us who are here right now who would like to care about our own body and function well and not have to go to the doctor, that it's interesting to. So I'm trying to act as a support and a translator of how is it that medicine can be so wrong about something that is actually their responsibility, especially for fertility. If you've struggled for 5 years to have a baby, and by the way, there are also articles that show that infertility on the male side is also linked to D. That means when there's no sunlight, there's no food, and that means that both partners should have their fertility controlled by the fact that there's no food, so they don't have babies, and they wait until there is food, and then they get pregnant. So on the male side, there are other studies about sperm motility and sperm production that are all about this as well. And it affects both sides of the pregnancy. And unfortunately, those are very difficult conversations to have. They have to do with, like, my male identity is whether or not I could be fertile or not, and that sort of thing. So those are not easy conversations to have. I'm going to stop and take a breath and let you ask any questions.
I do have a question. So in the storage, you'll often see B50, but you also see B100. Is B100, is that a fake thing? Is that really necessary?
As much as B50. Okay, so the fascinating thing for me is that bottle existed there. And actually, when I tell you the story, what happened to me physically, I ended up taking B100 just by chance, but it was perfect for my dose. Now, it turns out when I would use B100, so B100 means it has 8 bees. Now, keep in mind that these really are always interlocking. All 8 help each other. That's why there are 8 bees. I mean, it's a weird idea, but they were all being given together in specific ratios. I still don't know who came up with B100 or who came up with B50. I can't find the history of that. But B100 means thiamine 100 milligrams, riboflavin 100 milligrams. So then you get down into B12, it's micrograms. So and then folate is always in a different dose. And I really don't know the history of that either. The other important thing to know is if you walk into Whole Foods today and you pick up a multivitamin, it will usually have at least the equivalent of B50. So they think they are actually helping your health by giving you bigger doses of bees and charging you more for the multivitamin than you would get a generic CVS Walgreens. But in actual fact, you will be doing more bees than is healthy for you if you are taking that plus B50, and if you're taking that into the 4th, 5th, or 6th month. So knowing a little bit about what the bugs want and how when the bugs come back, that means that they are actually producing every single bee in the dose it should be for my body, okay? That means once I'm functioning with this microbiome intact, I have that organ, and now I have to take away the B50 or the B100. If you've bought that multivitamin, you will never know that. So I have a little subgroup of populations who are coming to see me for sleep disruption who've been taking B100 twice a day for like the last 5 years because they saw a naturopath. And at the beginning, they felt a lot better. So now it's making them not able to sleep, but they would never realize that because they've been taking it all this time. And the hard part is that there's a timeline over which this happens. And we just don't think of it that way. We think of the pills we're taking today, and then I feel crappy or not. And I've been taking D for 5 years. How could it be hurting me now? But it can't.
Right. Yeah. And I say that because at one point I was doing B100 and I wasn't feeling great. And so I did some blood work and we looked at my B12 levels and they were astronomically high. So I went off Bs for a little while and then I gradually went back on, but I did it just a couple times a week instead of daily, and everything was much better. And I checked the levels again and they were better. So, but I was just curious because I have seen the B50 versus B100, and you just always think, well, why not go for the 100? If I need 100%, why not go for that? But I can see what you're saying.
One of the problems is that there's been a lot of dogma established since the 1980s that said these sweeping comments like, bees will never hurt you. And you can always take bees because you can pee out the excess. And those are all based on real observations. It's just that you can't really generalize it the way. So one, thiamine is bright yellow. So most people who are taking bigger doses pee out yellow, bright yellow, okay? But that doesn't mean that you're peeing out all the rest. The second thing is they've generalized all sorts of observations about B12. So we used to give B12 at 2,000 micrograms in a shot, and you'd get this big, huge spike. So if you did the level the day after the shot, the level would be over 2,500. But if you do the level only 4 or 5 days later, the level would be down to 700. Now, that does not mean that you don't need B12 or that you do need B12. It means you have to pay attention to what you're doing with the supplement when you do the level. So that means, and B12 by itself, you really do have to do the level of B12 because it has to be supplemented separately in many people. And that's a longer discussion. That's a separate one. But that's the only B vitamin level that I think is really usable to say whether your body needs a certain vitamin. So many of the observations that are physically very dramatic with B5, you can have a normal B5 level and I can give you a large dose of B5 and you would be immediately agitated and unable to sleep. Or you can be very agitated, have anxiety all the time, not be able to sleep, and your B5 level in your blood is fine. And then I give you B100 and all that goes away. It suggests that the B5 cellular level in your brain, which we have no access to, is really what we're asking our brain. We're asking our body about that. Does it feel better? Do I mentally feel better? So some people say, my energy is better and I feel mentally better when I take B12. That's much more valid in my experience than looking at the levels. B12 levels seem to be usable, but none of the other B levels in my experience are really usable for that. So you have to make a lot of assumptions and then listen to your body.
So for women who are pregnant and going through taking prenatals and that, so should they look at their prenatals and see,
Absolutely.
does
Absolutely.
it contain the amount that would be comparable to just a B50 supplement? And if so, they're good. That's a good prenatal. If not, time to adjust.
That's a really complex issue, and I want to go over that with you. One of my clients who I took through this for her fourth baby is living in Oslo, Norway. And her OBGYNs are giving her multivitamin that says prenatal, but it has a lot of stuff in it that we don't use here. So it has high choline doses, it has alpha lipoic acid, it has high doses of it has more or less the equivalent of B50. And I was very freaked out by that, but she did spectacularly. So every single time she showed me that vitamin, I'd go, wow, but she felt great. She was sleeping well. The baby was coming along. So some people have already figured this part out, but that's a very different recipe in that prenatal than what we have in the US. In the US, you can't even know for sure if it's got all 8 Bs. Many of the times it has 3. And it really doesn't even matter if your OBGYN has made their own label of prenatals. You really do have to look and see, are there all 8 Bs and what's the dose? Then the most important thing after that is, how do I feel? Because if the B5 dose in particular, and it will almost always be dosed in comparison to the other ones. So if your B5 dose is, especially if you're doing a prenatal, if it's 100 milligrams in that prenatal, usually your thiamine dose will be the same. That's a very big dose. And if you don't feel good, and you can actually just stop it and say, how do I feel? You can go down to 50. How do I feel? Just like what you did. Keep in mind that what I was really interested in the very beginning of this was to get the sleep better. And what I thought about that was, if I could figure out every single little thing that brain wanted for every night, any of us who has sleep problems know that it's not as simple here. You just take this and it just gets fixed. You have to be paying attention. You have to be willing to hang in there and try to do it every single night. You have to get really routine about what you do and what you take to try to maximize the beauty of great sleep over a long span of time. That means that taking the Bs once a week usually turns out to be not as effective as trying to figure out, well, what does it really want? Where do I get the best sleep? And taking that every single day. And it turns out that B5 is a player in that, and is usually for the first year and a half. And then your body will say, I don't want any extra. You actually move through this span where it wants more. And then once you get to the end of the Right Sleep program, usually by then your body's made all the extra repairs and it does not want extra B5. And it will tell you that.
Okay.
So any more questions about that?
Just the next part of, so you're pregnant, you're checking this, you're going through this. Now, obviously needs change, the baby's growing, and you said at the 30-week mark is kind of when you want to make sure your microbiome's good, your B and D are good. Okay, and that sets you up for a baby that likes to sleep, hopefully by 6 months.
Yes.
So
even likes to sleep at the beginning, and mom's sleep is okay.
Yeah.
So both of those are a really good measure of, are the vitamins where they need to be? So then the next piece is, if the mom's D level is 60, it turns out the baby's D level is 40. That's a really important point, because I have a set of videos that's about how to do the Right Sleep program in your child, who's a 3-year-old toddler who doesn't sleep at all. That's a different question than, what should a normal baby's D level be when mom's D level is at its optimal best? Okay, so I have several patients who've been doing my program who gave their kid a multivitamin because they got their 2-year-old's D level and it was 45, and they give them a multivitamin even with 10 milligrams and they wake up screaming in the middle of the night. That means if your child has never gone through sleep deprivation, if you actually have a kid who's normal, they frequently do not do well by giving them vitamins, and you have to pay attention to that. Now, the other way to look at it is also, when mom's D level is 60, her breast milk has enough D to give the baby, because this was the way it's been for, as long as humanoids have been around. All other animals, all other mammals are passing D to their babies.
Okay.
That means my D in my breast milk should be sufficient to keep my baby's D level where it should be normally, and to have enough D to establish the right microbiome in my baby. So probiotics are a relatively recent development, and they make money for somebody. None of the other animals are using probiotics. They're just eating the same thing. So that means if your D is in the 60s, your baby's D is in the 40s, she's sleeping well and she's establishing the right microbiome, because all the bacteria that she gets in is favored by having a good D level that mom is feeding in the breast milk. Also, there's some really interesting things about D that's in breast milk. It's not actually D25OH. So it's the D that we take the D pill or we're in the sun, and it hasn't yet passed through the liver to have the 25OH. So there's some really special things about D and passing D to your baby, which means that it's not exactly the same as putting D drops in the baby's food, okay? So the other thing is, this was primarily developed 250 million and more than that years ago, and the babies would pop out and be in the sun. That was not bad for them. Okay. There's this really interesting article from 100 years ago that's describing that in India, which is a southern tropical country with very dark-skinned people, that 100 years ago, rickets was not described in the poor who were digging in the dirt, who were dirt farmers, where the baby comes out and is put on mom's back and she's out in the fields 2 days later, but was common in the upper castes who were kept inside and were wealthier and had osteoporosis in the women and had babies who had rickets, which was actually a baby that doesn't sleep, who cries all the time, who has more infections, who has slow tooth development, early dental caries, and then finally gets so sick they won't walk. So these things were known even more than 100 years ago, especially in populations that were still outside, putting their babies outside. It prevented rickets. So one of the things to know is, I have an actual set of videos that's about infertility, pregnancy, and your first year with your baby, because you are really the major source for the baby. And then the baby doesn't need probiotics, because if the baby's D is good enough, the right bacteria will be selected for. And then another set of videos as to which age. So are you doing this with a toddler or with an 11-year-old or with a teenager? And there's some differences in that. And I want to make some points about that. In my view, the reason why we want to get a D of 60 is probably because we've been sleep deprived in the past, which then says we've had a deficiency state for 15 years. It was so long that we developed a sleep disorder. And it's my hypothesis that we're having to overshoot a little bit to get that sleep disorder to go away. Okay. The observation is, when did my patients say my sleep is better? When it crosses over 60. Okay. Now, that is not the same as asking, what are the hunter-gatherers that we still have on the planet who don't even have a hut? Okay. They still sit under trees. They're moving around. They don't sit inside ever. What are their D levels? Their D levels in the 40s and low 50s. And again, that's a mean level. Okay. That means what I'd like to ask out of that group is, who's the best performer out of your group? Who had the low D level of 30? Oh, that was an 80-year-old person. Okay. So if you do a mean and it's all age groups, it's a slightly different question. But what it means is, if you don't have anything wrong with you, if you have no sleep problems, you have no problems with your belly, you don't have to go to the doctor because there's nothing wrong with you, and you can get pregnant, then you don't need to mess around with this. You might need to mess around with it after your third child, because even though you had the same sun activity, you've actually done something that sucked up your D. Twin pregnancies are particularly stressful because they suck up twice as much. So you have to pay attention to something like that. Now, take that information and then apply that to a 3-year-old. So that 3-year-old who's never slept well, who's now very cranky, complains of leg pain, not doing well developmentally, never sleeps through the night. That kid has only had a sleep disorder for 3 years because he's only 3. That means you may not have to go to a level of 60. We don't really know because
Okay.
I haven't had enough experience with that age group. Instead, what you do is you come in at little tiny baby steps and you increase things until you see your kid sleeping through the night, and you do one thing at a time. So you do it in a slightly different way. So in certain age groups, I'll have you do a multivitamin that has a little bit of D and all the other stuff, and you're using it as though you would that Whole Foods multivitamin. So you're using enough of it, and in little kids, you basically go up to like 2.5 multivitamins, and you get approximately the same as B25, okay, that sort of thing. But you're going up and you're watching your child sleep as the endpoint, not the blood level. Because I think the actual event of watching them sleep is much more valuable. And then you get to see, oh, when they're sleeping like this, then this is what results in their behavior during the day. Also, you pay attention now, once you have this framework, what is he like in, end of August? And you may not be doing the blood levels. I hate to do blood levels for 3-year-olds because it's just a lot to take on. So maybe after 4 or 5 years old. So those videos help tell you how to change this process a little bit using the same idea set, but in terms of dosing, how it's different.
So, and this is all fascinating. So when a woman delivers then, and you go through, it's a big trauma on the body, a lot of changes, a lot of depletion. Are there things to do right after delivery to boost you back up quickly so you can get sleep? Because obviously you're being interrupted every 3 hours to feed the baby if you choose breastfeeding or any type of feeding, basically. So are there things to consider during that period of time until baby sleeping through the night?
Okay, so it depends a little bit on what's happened during the end of the pregnancy. So one, my women who have D levels of 60 all the way up to delivery and deliver are actually waking up, feeding the baby, and going back to sleep.
Okay.
And usually it's with the baby in the bed.
Okay.
And so they feed and then they go to sleep. And then they feed and they go to sleep. And then they feed and they go to sleep. And most of the time, in comparison to what it was like with the last 2 deliveries, that is a much easier process. Okay, so that's view number 1. So I don't think there's anything you have to do or assume that you're going to be depleted. Okay. You've already done B vitamins and you've already done D. That means when you're going through your pregnancy, you should watch how you're feeling and then decide. So then if you feel like you're really not doing well, but keep in mind, this is heavily about postpartum depression. This is all postpartum depression, weird psychotic behavior after delivering, the tragedy of that, where you don't feel connected to your baby because you are so mentally affected by these not having the right neurotransmitters and not sleeping. So if you want to do something and you haven't been doing right sleep, you go get your D level done. And then you do exactly the same thing. If you haven't been doing D during your pregnancy, you start on this program exactly the same way. You establish a dose you want to start, you take the B50, etc. And that still means that you will be contributing to your baby as an infant breastfeeding, and you will still be passing the B vitamins, but the B vitamin amount that your infant will get from you now that you're breastfeeding will only be the B vitamin amount that's in your bloodstream. Okay. That means if you're taking B50 and your pediatrician freaks out, really, that would be the same blood supply that you would have if you had a normal microbiome. Because what are you feeding your baby in your breast milk? The amount of B's that are being made by the microbiome and the amount of D that you're making. So you're not doing anything that's weird. And when you get to the end of 3 months of B50, you'll start to feel like my sleep isn't good and I'm a little agitated because I need to stop the B50 now. And then your own microbiome will have grown back and start feeding the baby that too.
Okay. That makes sense. And it's great to see that you don't have to do anything drastic after delivery as long as you're maintaining and observing and checking throughout. So then with your Right Sleep program, we've talked about it for the general population, and it's the same thing if you're pregnant. It's the same program, or do you have one specific for a pregnancy?
It's the same exact program with these modifications. Most of the modifications are about here are the fears that I would have when you just look at these vitamins. These are big doses of vitamins, you know.
Yeah.
If this is the most precious thing I'm going to have in my life. So I want to make sure that there's a logical framework to say these are safe, because I haven't seen 2,000 women through pregnancy. I'm not an OBGYN. I've seen 2,000, you know, I've seen 8,000 adults go through this, but I want to give you the framework in which I'm proposing to you that this has worked several times through actual pregnancies, but also I want you to understand why we're doing it this way.
Yeah, absolutely. And I get that, because yes, everyone wants to have a healthy baby. You also want to be healthy to enjoy your baby. You want to be able to sleep. And a lot of times as an adult, we always say, oh, you can sleep when you die. And the only time that people really don't say that is when they have a kid. They realize the importance of sleep right then, because they can see the immediate effects of sleep deprivation. So they don't take it seriously until then. And so if we can set the stage beforehand, this is amazing. And the impact of these two vitamins, well, vitamin and hormone on this is just incredible.
And then there's another piece, which is about avoiding the sun. Okay.
Yeah.
The current recommendation of American Academy of Pediatrics is your baby shouldn't get touched by the sun until 6 months. That's wrong.
Okay.
So one, you should still pay attention to what kind of skin type your baby has, you know, and they may have a different skin type than you. So one, if you go outside more, still we're lucky to have sunscreen. That means we can actually modify what happens to us. We're lucky to have D levels in the United States. It's easy to get D levels yourself. It's not around the world. So that means you can biohack pretty safely. Biohacking is always risky. I don't care what it is you're doing, but that means you can do the same thing with your child. You watch what happens when you guys go to the beach and you let the baby be outside and you cover, and you do not put covering clothing on until you know, oh, they're starting to be a little pink. And then within a very short period of time, you'll know how much sun the baby can tolerate. And as the summer wears on, they'll make a tan and tolerate more. And then you watch how they sleep. And then you say, well, that's interesting. We went to the beach. They slept really well and they were running around all day and they weren't as cranky and they didn't ask me for an ice cream cone and they didn't. So you make observations to fit this to each one of your kids. And each kid is actually unique. Each one has a different skin type. And then you can say, oh, this kid is going to burn. So normal moms already get that idea. They don't, the real message was don't let your child have a terrible sunburn. That was the original message in the 80s. That has morphed into a whole industry around sunblocking clothing that is wrong. That is absolutely wrong, especially for dark-skinned people. That has led to their poor health. So the second piece is just to make these observations about what is my 2-year-old like when I just put them out there and you know, their little pull-ups and let them run around. How do they do? The idea that we are attached to the soil and to the energy wavelengths of multiple kinds, not just D, but just the energy of our planet, means that was part of our biology and we don't understand it yet, and medicine poo-poos it all, but it's really important. So just see what your kid is like after spending more time outside. That sort of habit, and then watching what happens when they go to school and putting together, oh, we did fine until about November, and then he started to wake up in the middle of the night. Uh-oh, I wonder what his D level is. And then once you're doing that, sometimes in the earlier ages, you may just start with 2,000 when they start to wake up in the middle of the night, and you actually saw that go away spontaneously over the summer. And then you see what happens. And then if it gets to be tough and you're not sure, then you have to go through the right sleep program and actually take the vitamins and do all that. But if you've followed, I would prefer to see all of this prevented by education of pregnant moms and babies, and the fact that we all have to be outside more in childhood. If you prevent this in the childhood population, then you don't have all these teenagers who have terrible sleep disorder, terrible mood disorders. There are all these articles now about suicide risk and endocannabinoid levels in the brain. I mean, really scary stuff that we could easily prevent if we started to actually use what we know and just modify our outside experience.
Yeah, that's incredible. And it's amazing to think you can impact fertility, sleep, pregnancy, the health of the baby, health of you. I mean, there's so many different things just by looking at these two vitamins. So can you remind us, I mean, we've covered so much, but can you remind us, how can people get started on the Right Sleep program? Where do they go?
My website is www.drgominak, Gominak.
Okay.
And there you will see all sorts of general education. There's a learn section. Under the about section, I have published articles that talk about the science of this, if you're interested in that more in depth. I have not written the book yet, so that piece is really the primary science publication. Then there is a workbook. Once you buy that, you are buying the Right Sleep program now. The workbook is designed to be the how-to. It's not the why. We're talking about the why.
Yeah.
The how is in the workbook. Then as you buy that, you also get access to the links to the videos if you want to undertake this pregnancy and during with children. You also get access to the question and answer sections, which are once a month, and access to the last year where all the question and answer videos are there for you. And there's access to a private Facebook group where you can talk to other people who are struggling through Right Sleep. I also do private coaching. So if you just want a single session where you can say, these are my diagnoses, do you think this is appropriate for me? Is this a thing that I should do? Then I also have what's called a Right Sleep strategy session, which is one visit. And then I have private coaching where you are coached for the whole year.
Awesome. Oh, it's great. And I love that you have different levels for everyone, and covers all the bases, and people can make their choice on what do they need, what suits them. So I appreciate your time greatly with all this, because this was amazing information. I can't wait to share it with many groups where I'm in. People need this. They really need it. So I appreciate your time once again. Thank you so much.
I'm going to add one thing.
Yeah.
That is, I've been reading on some of the Reddit posts that some people start D and they get insomnia. And that's a horrifying experience because they had bad sleep before and now they get insomnia. And it is my feeling that it's because when you add D by itself, if you are profoundly low in the Bs, if you were bad off enough that you were looking to help your sleep and you just add this one piece and you don't understand the bigger picture, that you can have a really agonizing outcome. And I keep trying to get people to understand that this is a much bigger picture, but most of us just want to go, okay, and I'm the same way. Okay, I'll just take this one thing. Okay. You really do have to spend a little time and understand the impact of taking one chemical that then makes all these other chemicals are low. And then the effect is more insomnia, not less. So it's a little more complicated than most people would like, especially those that can't sleep and can't think and are chronically confused and have a daily headache. But it's definitely worth it to understand the bigger picture.
Okay. Oh, this is valuable. I appreciate you adding that little bit in, because yes, people have a tendency just, oh, I'm gonna just go take more tea. And I can see that, especially if they haven't looked at their B levels or looked at that aspect. So, well, thank you once again. Really appreciate it. Thank you all for joining us today. Really appreciate your time, and please join us again next week. Please go check out Stasha's website, join her Right Sleep program. I've had clients who've used her before, so they have raved about it. So please go check it out, go jump in on that and improve your sleep and your health of your baby. Thanks. Bye.